Good afternoon, everyone. Thank you for joining us. Today is our fourth of five health equity webinars. Today, we will be talking more in depth about community collaboration. If you are on this call, we are a smaller group, so if you have any questions, please feel free to unmute your line. You can raise your hand or put something in the chat. If you are watching this recording and have any questions, please do not hesitate to reach out to me. And with that said, Lindsay, I'll turn it over to you.
Thanks, Laura. Welcome, everyone. Thanks for joining today's webinar. Today, we are talking about community collaboration. So real important when we're thinking about health equity, because I know I've mentioned in some of the webinars is that, health equity is just not something that we should be tackling ourselves, although we can, do some of the work, we could get started, but success really happens through, collaboration and starting to do some, whether it's community collaboration or with community-based organizations, or even just key members of your community. Collaboration is really key for success in this health equity journey. And again, I just always like to reiterate, where we are along this continuum here, and that we're really on this journey. And so, hopefully, as we've worked through many of these webinars, that you and your organization are starting to kind of advance and move through this continuum. But although, and please just don't get discouraged if you really are still in those initial phases as it relates to health equity. Just a reminder, just some of our upcoming events. We have one more of the 5-part webinar series scheduled for August, and we'll be talking about implementation and evaluation. So it's really kind of bringing it all together. So we'll talk a little bit about that after. And then really, I know our last assignment that we had was really just to come prepared to do some discussion. I think this is a great opportunity to share some ideas around community collaboration, community-based partnerships, and how we've leveraged these relationships to support our patient population. And so again, I have some kind of discussion points. I'd love to kind of open it up for the group. Again, as Laura mentioned, feel free to take yourself off of mute or utilize the chat function. But really, just kind of thinking about community-based organizations or community resources that your organization may tap into. And the question here is, has your organization ever inventoried the community resources or organizations that exist that maybe support your patient population or just are kind of out there that, provide a certain need for community? And, love to hear if anyone has done that. Is there anything that you found out throughout that process and going and doing that work? Did you find that if there were any gaps in community resources or any duplication of services? The reason why I like to ask this question is sometimes we may not know what is actually out there in terms of community resources unless we really make that concerted effort to do that inventory, to do that kind of environmental scan of those community-based resources. And, I share with the groups that I speak with, I was working with a critical access hospital in Vermont, and they wanted to implement a center of excellence around geriatrics. And they were just saying that there was not a lot of resources available for the geriatric population in their kind of smaller community in rural Vermont. And, so we came in and we really just started with that environmental scan. So let's see what's out there. So we brought together kind of these focus groups, and we started to figure out that there were quite a lot of community-based resources that were specifically supporting the geriatric population. So things like transportation, just geared towards the Medicare population, Medicare and Medicaid population. They had access to that. It was a transportation system that, they really had never utilized or it was underutilized. They had housing support for the Medicare population. And, so they had all these different resources and they just had no idea. And so it was really interesting exercise. So just kind of opening it up to the group. I'll pause for just a moment and see if anyone wants to share if they've completed this type of process and if they've found out anything interesting.
Lindsay, this is Lara. I'm thinking folks are kind of in this process at the moment, with all the new measures coming into NBQIP. I think this is, people are either in the middle or just getting started of this process.
Yeah, and I think it's a really important process to go through because even as a community collaboration as part of the health equity measure, and we'll go over specifically where in the measure this really kind of speaks to, but also on the social determinants of health, the SDOH screening and screen positive NBQIP measure too, because when we have identified, a patient that screens positive for one of the 5 health related social needs, I would hope that our intention would be to connect and make a referral or connect a patient with a resource that dependent on that health related social need. So really great exercise to kind of kick things off as it relates to community collaboration. But really, let's talk a little bit about kind of why it's important and a little bit more about kind of the intent of community collaboration. This here is just pulled out from the Joint Commission's Health Equity Certification. It's a new certification that they have put forth for any organizations that are within the JCO family and have really kind of excelled as it relates to health equity. They now have a certification program, but one of the key pillars within this certification program, just to kind of point that out, is all around collaboration, collaborating with and engaging with patients, and then engaging with community organizations. And those, organizations that collaborate with community organizations are really are their intent is to really identify community level needs to address. And I think, it's just it's really important that, and we are seeing more and more the push towards community collaboration as just a key to success in health equity. As I mentioned, really health equity should not be tackled in a vacuum or alone, or, we do find success when we do collaborate for sure. Strengths of multiple organizations coming together will have and can have the greatest impact. Case in point, during COVID, where we had, where we saw organizations that had historical relationships before, the hospital and the health department, those organizations that have collaborated and had existing relationships were far more efficient and effective to quickly roll out vaccines. And versus those organizations that really were just in that siloed kind of landscape, and they were slower and less effective in terms of rolling out vaccines. So that's just where we have these strengths and leveraging those strengths when we come together. Also, the importance of community collaboration can really remove the strain of healthcare providers and hospitals, where the community-based organizations really are there to help and address some of the community health issues that are non-clinical. And so, although we may make those identifications of food insecurity or lack of housing or we cannot necessarily always be the organization that's going to solve the problem, versus where we provide that clinical medical advice and solutions. We have organizations that we can partner with that take some of those health related social needs patients may need. There's also opportunities around sharing data, collaborating in data collection, and then partnerships can certainly look different, really depending on the need and the purpose. And so this brings us really to the partnership spectrum. As I said, those partnerships and those collaborative models can look really different depending on what that purpose is and what the need is. And across this spectrum, you have, that not involved partnership where there is no partnership, right? Then you can move into more of a funding partnership, and that just might be something that looks like grants, where you come together for grant applications of some sort. Then there's networking, where you're exchanging ideas and information. Coordination is exchanging information and altering activities for mutual benefit and purpose. And then collaboration is exchanging information and sharing resources to alter activities and enhance the capacity of each other. And then alliance is really this formalized partnership among multiple organizations that merge initiatives, common goals, and metrics. You may find like a working relationship with some partners is really enough to meet your needs. And with others, you may work towards more of a collaborative partnership model. So really, again, depending on your needs and purpose. What is also really important is when we think about collaboration is not only do we collaborate with various types of community-based organizations, but it's really important to also seek out and cultivate relationships or partnerships with diverse groups. Those can be patients, stakeholders, or community organizations. And when we do that and we seek out those, it really kind of begins to help us support the diversity of our patient population. And it starts to allow us to expand into different perspectives that we may not tap into or may not have as our own a standalone organization. And those perspectives can really vary. So seeking out and engaging diverse groups around socioeconomic status, insurance coverage, English proficiency, cultural and religious practices, and physical, mental, communication, or cognitive disabilities. And there's certainly barriers that exist to community collaboration. And, you may experience some of these and may see some of these existing within your own organization and really, may exist and really prevent you from moving and advancing towards a collaborative model. Some of those is the lack of the leadership support, competing priorities. And I think when every webinar I think that we've shared of this health equity webinar series, that leadership support tends to be one of the driving factors of success as it relates to health equity and executing on a health equity strategy, implementing various initiatives, sustaining those initiatives. Leadership support is definitely very high up there, and certainly lack of leadership support can really play a role in how successful an organization is around community collaboration. You may have competing priorities. Maybe your strategic plan as it relates to your organization has a lot of, high priority items on there. And, for the next 18 months, you are just riding the train and checking off those high priority items. So, sometimes the barrier to community collaboration could be those competing priorities. There's also that silo mentality, the stay in your lane thought process that exists between community organizations. You may have an organization that only, that only wants to do, what their organization intends to do and does not want to participate. And, they're going to go off and do whatever it is that they do independently. And so there may be some of that stay in your lane thought process. There's also resource constraints, certainly our own organization, as well as other community-based organizations have resource constraints, whether it's staffing or financial constraints. There's limited recognition and payment models that support population health. There's this unwillingness potentially, or even just a willingness to share information and resources. There's disjointed technology, from systems communicating and coordinating between each other, or just even, technology from a data download or data abstraction standpoint. And there's duplication or the lack of coordination that also exists. So what are some of the strategies for really engaging communities? We really put hospitals at the center here as a key kind of focal point in community engagement and collaboration. And these are kind of the ins and the inputs and the get outs of community engagement for, where a hospital provides community engagement strategy, a strong partner, and staff and board as ambassadors. And it really gets to the point of a better community health, alignment with new payment incentives, a solid base for advocacy, buy-in, and increased utilization of services. And there's lots of different types of community partners. And, as you begin to do your inventory of, community-based resources and partners, I would encourage you all to kind of seek out and explore what types of partners exist out in your community. And so you may have kind of health system and providers, you have maybe community clinics, hospitals, other healthcare providers in private practice. You have the payer landscape, both public and private payers, private insurers also are, within our communities. There's private sector companies, pharmacies, local businesses such as grocery stores or manufacturing, local and state government agencies, which would include health departments, social services, any city council, service organizations, YMCA, United Way, agencies that deal with community infrastructure, transportation, schools, homeless shelters, police, law enforcement, and community organizations such as the faith-based organizations, food banks, coalitions, and task force. And again, you may have some of these types of community based organizations that are within your communities, or you may have a whole lot of them, and maybe some that are not even on this list here, but really important to kind of do that environmental scan to see what's out there. So when we get started and we've identified, maybe it's a few different community-based organizations, or we've identified based on our purpose and our need, a potential community partner, how do we kind of advance that collaborative approach? Well, it starts with that internal leadership, support, and buy-in. Leadership needs to understand the why. They need to be, and really, engage and support this collaborative approach with this partnership approach. And then there needs to be sort of what we call this partnership level setting. What do we hope to achieve? What is, it goes back to our purpose and our need. What's our desired outcome? This also might be something that comes out of your health equity action plan and part of your strategy, that we've articulated kind of what our desired goals and outcomes are. And then also understand where there's that mutual benefit. What are both of our organizations going to get out of that as well? And then we really move into more of that structure and process. What is that partnership would that community-based organization really gonna look like? And what are the process that we'll develop together? And those really start with those clearly defined goals, defining the roles and responsibilities between the members or the groups or the parties, who's doing what, who's responsible for what. Establishing a charter for the partnership is really, it's a nice kind of outline, the intent, the goal, the roles and responsibilities, everything around the structure and the process gets put into that charter. Establish clear language and shared definitions. Certainly we want to be on the same page as it relates to what we're talking about here. Do we have the same defined priority population? Are we looking at, similar data sets and we both understand the data? That's agreeing on a target population. Again, I think that comes with that clear language and shared definition, agreeing on that target population, creating that shared vision of success. What does success look like? How are we going to measure that? And then discuss the ways to engage and sustain program activities. And we're going to touch more about that on our last webinars of this health equity webinar series around, engagement and sustaining initiatives as it relates to health equity. Another key component to partnerships and potential community-based organizations is where we look at partner assets. We may not, fully partner with, an organization that's going to provide us, everything that we need, or, vice versa, but we may tap into a particular asset that partner may provide. Certainly we do a lot as a healthcare organization, but we may have some gaps and we may need to seek out a certain or particular asset to help us advance our health equity initiatives. And so those might be any type of resources, skills, or expertise that's really important to allow for us to be successful in this space. When we think about funding, we're going to talk about funding and resource allocation in our next webinar, but one way to do that is to, maybe obtain and seek out grant funding. And internally, we have no expertise in grant writing. That might be an asset, a partner asset that we may need to go out and seek, because it is something that we really would like to have in order to be successful in, writing a grant, securing funding for a grant to support and sustain our health equity initiatives. So, just as an example, certainly there's lots of different ways that we can leverage different types of assets, depending on our purpose and our need. We certainly also want to make sure that, I mentioned, the purpose and the need. We also can be really successful with our community collaboration if we align those organizational priorities with our community need. So making sure that we certainly utilize the data analysis that we've talked about in the last webinar, and really understand based on our identified priority populations. And I say that quite frequently because that's a key component of the health equity MBQIP measure, and domain number 1 is that identification of a priority population, which will allow you to start to think about your organizational priorities based on that community need. So again, once we identify need and purpose, we then continue to seek out those relationships and partnerships. As I mentioned, the importance of leveraging our data. whether that is community health data, your community health needs assessment really is a great starting point for new community partnerships. Our community health needs assessment really also has likely identified through the stakeholder interviews and that community outreach some community-based organizations that exist and that may support different identified populations or support diverse backgrounds and so forth. So really making sure that we review health data and we can help kind of define and clarify what those shared priorities are and those assets to ensure that the future interventions or initiatives are data-driven. So really making sure that we're backing a lot of what we're doing and making those strategic decisions moving forward based on data. And here's just an example really of just an exercise here where the identified need was around reducing food insecurity for this particular population or this particular community. There was 3 solutions that got put forth, screening for food insecurity, food truck, and food pantry, and the different initiatives that came out of those 3 solutions. And at the bottom here is where you can really see what those resources are or those community-based partnerships with food shelters, with the schools, with the food banks, the grocery stores, the community gardens, the farmers market, really leveraging those particular resources that happen to be community-based organizations to support the various initiatives around reducing food insecurity. So just as a little bit of an exercise, a visual kind of rendition, if you will, around how an organization can kind of map out what the resources or those community-based organizations in their linkages to some of those key initiatives within a health equity action plan. The other way that we can think about engaging with our communities is a way that we can think about collecting feedback on patient level and community level needs. So leveraging maybe a patient family advisory council or community advisory committees through focus groups. If there is a particular identified purpose or need, maybe you will establish a certain focus group. I know when we were working with that critical access hospital in Vermont, and we had, our focus was around the geriatric population. And so we pulled together different focus groups of, different combination of community-based organizations. We have had healthcare workers, we had community members, we had patients, we had families, all scattered around in these multiple focus groups. And we're really able to kind of leverage their thoughts and ideas on particular areas of purpose and need. Other ways to collect feedback, certainly surveys and different channels to solicit feedback from community-based organizations is really key. We worked with a hospital in Alabama, and they developed what they call a joint health partners group. And it was a quarterly meeting that they pulled together all the community-based organizations, healthcare related, organizations that may, touch their patient in some way, shape, or form. So, EMS and health department, and they had some physician clinics that were independent. They had some dental practices, a local SQHC, so they had a whole bunch of these community-based healthcare organizations all meeting on a quarterly basis, really to solicit feedback, to get a better understanding about kind of what was working well within their community, where were they seeing some gaps in services and coverage, and came together to start to think about solutions. And I think that's important. And there was some pushback at the beginning. Just to bring everybody together it's a gripe session. And people just want to kind of come and complain. We often hear that when folks start to start their patient family advisory council, where it's a way that we solicit feedback, but oftentimes it turns into a complaining session. So there's some barriers and some work to overcome some of that mentality. But this here is just an example of an organization that certainly invited folks from their community to a dinner. During the dinner, they shared more information about the hospital services, and it was a chance for community members to really start to kind of interact with leaders and folks from the hospital that they've never, kind of had encountered before. And then likewise on the hospital side. So really just, a informal dinner type setting to really be able to solicit and collect feedback, which is really another way that we collaborate with our community. And so we may, that our purpose and our need may drive us to just seeking out these patient level or community level type mechanisms for feedback. And lastly, in this particular section, before I kind of go into some examples of some ways that some organizations have really kind of collaborated from a community-based organization to collaboration. Well, it's a mouthful. But here's some kind of things to think about as it relates to collaboration. Is there opportunities to expand the role or relationship with any of your existing community partners? So thinking about, again, as you go through that inventory of your community organizations, or if there's an organization that you really have a great relationship for, and we only, partner with them for one particular line of their business. And really, maybe there's an opportunity to expand into other areas of their business. What does that look like? Is there an opportunity to kind of enhance that relationship a little bit more? How do we leverage that community health needs assessment? Again, I think I have shared before the community health needs assessment is really a great starting point. And something that should be leveraged as you continue to embark on this health equity journey. The mechanism in which a community health needs assessment is conducted, the information and the data that is obtained really is key in the health equity kind of strategy and plan for the MEQUIP measure. So really good kind of starting point there, and leveraging, how we engage in those community organizations. That same mechanism, the same kind of thought process around that community health needs assessment can be really replicated and should be. Does your patient family advisory council play a role? We just kind of talked as a key way to get some of that patient level feedback and communication is through that patient family advisory council, if you have one. If you don't, is there an opportunity to think about something like that to solicit that feedback? And then making sure that we align those priorities with community need, really kind of driven by our data and analysis, the collected information and data that we obtain, and the kind of the data use that comes at the end there. We really can't assume that the hospital knows what the community needs are unless we leverage some of that data. Okay, just a few more slides and then I'm going to have a chance for some discussion. So hopefully we can take ourselves off of mute because I know we'll have probably some time remaining at the end here. Let's talk a little bit about, just some kind of summary points here. I sort of just mentioned that we really can't rely on the assumptions about what health inequities exist in our community, uh, unless we really do kind of that legwork to identify those inequities. And, certainly data, both state and national data, play a role, but really we need to get, more granular to really understand what is happening in our community. This making sure that we understand it and identify those health inequities. We assess community assets, needs, and challenges, and until we do that, we really just don't. We can't really rely on just our thoughts and feelings about it. We want to make sure that we examine multiple aspects of health in our community to get that clear picture of inequities. And making sure that we are really looking at them from and really stratifying those data elements. Remember, we talked last time about stratification, differentiating your data, looking at your data from race, ethnicity, age, language, and really will provide better insight into the needs and the health of our community. Use appropriate tools to identify health inequities, tools such as your data sources, right? Your community health needs assessment, your different types of databases that exist maybe in your state, within universities and hospitals, can really provide some of that local data. Partnering with, other organizations such as, the Community Works or the police department, or they all have access to different data sources, and how do we leverage those to really identify those health inequities and the needs of our community, to be able to make those strategic decisions around community collaboration. So, and then really engaging those community members based on some of that information that is collected, and even partnering in data collection and interpretation with community-based organizations. And lastly, what gets measured gets improved, for sure. So just want to provide two examples of ways that two organizations or a couple different organizations have kind of, come together from a community, identified a community need. This one is about two rural hospitals. They are both located in rural Illinois. The first one is Marshall Browning. The second one is Pinckneyville Hospital. And they identified a rising rate of homelessness in and around their community and in their county of Perry County. And they, between the two organizations, identified some causes or some root causes of homelessness, in this increasing rate of homelessness around lack of job opportunities, poverty, and lack of support for community reintegration after incarceration. Both of these hospitals have quite a lot of prisons around them. So, that reintegration after incarceration was a big one for these two organizations that and saw that, that rate of homelessness increasing because of that. So these two organizations came together based on that purpose, that identified need, based on, doing that root cause analysis where they, leveraged key stakeholders, they've leveraged data and information, interviews, they got to the root cause of why that homelessness rate was increasing for their rural county. And they came together and they established what they call the Transition to Hope Coalition. where it includes community members with lived experience and representatives from law enforcement, mental health service providers, and law and local health departments. And what the coalition came together to do was they went out and sought funding to implement different strategies to reduce the rates of homelessness for their county. And some of those strategies included a warming center, transitional housing, a soup kitchen, and social support services. So really, I think this is one of the better examples about two rural hospitals coming together, really identifying a shared need between the two organizations, creating a coalition, which I am sure had, a charter. They identified roles and responsibilities of the coalition. They had all these kind of key community members and members to participate in their coalition, and they've really done a nice job with the various strategies and initiatives. This is a second one. This is a little bit different. This was a county public health department in Rice County, Minnesota. And over the last several years, they certainly saw this demographic shift, where they've seen an influx of Somali refugees and Latino immigrants into their community. And they really started to think more from an internal perspective, where what were some of the solutions? How can we, as the county public health department, support these populations, these patient or these community populations that are coming into our community? How do we better serve these folks? And so what they started to think about was cultural competency training for their staff. They needed to kind of learn how to better serve the populations. And then that really started to lead them to developing more of the health equity and health equity work and develop a health equity plan. So they conducted some data analysis, and they developed a plan, and they developed a health equity approach. And they basically started to see that of the Latino community that were had immigrated into their county, some of the data that was showing was that there were a high number of pediatric obesity within the Latino community. And based on, identifying, that we have this priority population, we have an identified health-related need of the, growing number of pediatric obese patients within the Latino community, we really need to do some work internally. And so they really focused on, as a way to kind of advance their work in this space, they wanted to make sure that they provided staff education. They looked internally around their hiring practices and education and training on authentic relationships with communities that experience inequities. Their work was all very much internal. They knew that they need to to really internally focus to be able to better serve these populations. And so I think we've talked a little bit about, in that strategy webinar, that a lot of the work and that needs to happen internally for organizations to be successful from an external perspective. So from, we need to kind of do the work in our own house before we can help others fix their houses. I think I just made that saying up, but it sounded good. And so I think, this is just a different example of kind of how this particular organization kind of came together from an internal perspective. So this leads me to some discussion points, and I'll put these up on the screen here, and love to hear from you as it relates to community collaboration. So if you haven't kind of gone down this path of, and again, it doesn't necessarily have to be around health equity too. there are different ways that I'm sure that your organization has partnered with community-based organizations to better support individuals with maybe complex or social needs. And how have you done that? How have you partnered with those folks? Has your organization entered into new partnerships or financial models with payers? Have your clinical teams within your organizations worked with community partners and local public health agencies to improve health outcomes? And what current outreach activities or community partnerships are you engaged in? And I would say it doesn't have to be around health equity. As you're thinking about the social determinants of health measure, and those 5 health-related social needs, have we found community organizations or resources for our patients in those 5 areas? Or has that been difficult to do? I know I've heard from some organizations, we always hear as rural organizations, right, we have gaps in resources as it relates to mental and behavioral health. We have gaps in resources on transportation. In some markets, housing is a big factor. And the lack of housing or the affordability of housing can be a factor. Anyone want to share anything around community partnerships?
Lindsay, this is Lara. Can I pose a question to the group?
Absolutely.
I'm just curious, how many folks on the call have an active and engaged patient and family advisory committee? Or if not, how many are interested in building and moving forward? Because that is a question I have been getting from folks lately.
I think the patient family advisory committee or council, or I think it's whatever you want to call it, but I think they're more important now than they ever have been, especially as it relates to some of these health-related social needs and kind of connecting with your community on health equity strategies. If you already have a PFAC in place, I would leverage it in this regard.
Yeah, and that's what I was hearing on a national MB-Quip call that I was on a couple weeks ago, and so it kind of piqued my interest, and so I was just curious. I was going through our recordings, and Lindsay, I think you did one for us a couple years ago on this.
I think it was on the first swing back.
Right.
Yeah.
So would that be applicable? Do you think that would be a good resource for folks?
Yeah.
Refer back to? Okay.
Yeah, I say, yeah, absolutely. And, I think with what we're talking about today, thinking about it, and I will use this term as like thinking about it with a health equity lens, right? How can you either dust off an existing patient family advisory council or re-implement one or implement one with this kind of health equity lens, given that this is such a need right now.
I will be sure to put that recording in the email with the slides and this webinar recording just for reference for folks.
Great. Okay, well, anybody want to chime in? Okay, quiet group today. That's okay. I think I spoke to done a couple different webinars this week, and everyone's whole tired. I don't blame you. So just a little follow-up for next a webinar. We have it scheduled for Monday, August 12th from noon to 1. And again, as I mentioned, we're going to talk about implementation and evaluation. So really tying it all together. Thinking about your strategy and your health equity action plan, which may be something that is the action plan that you've developed within your community health needs assessment. And those, so what makes a good goal? What are some of those key initiatives? How do we prioritize the initiatives and so forth? So we're going to talk a little bit more about that. And then I do have some, discussion questions built into the webinar. And so we want to talk about how your organization measures success. And as always, when we do discuss and open it up to the group, it's just another way that we can continue to learn from each other. And I think that's really important, especially with such a kind of a newer concept for a lot of organizations. So. Also, I'll provide the webinar, the slides to Laura, but in the slide deck, there are 3 links here. And I would certainly encourage you all to go out and look at those links. These are toolkits that are available. And I love toolkits because it does some of the work for you. So whether that is, an identified process in which that you can follow, maybe some templates or forms that you can leverage. These 3, I think, 2 out of the 3 definitely are toolkits. So there's the Community Engagement Toolkit for Rural Hospitals. There's the American Hospital Association Community Partnerships resource there, and then Building Coalitions to Promote Health Equity. And there's a toolkit embedded in there. So a couple different resources for you. As always, reach out to Laura or myself if you do have any questions. Happy to answer those.
Yes, and I just wanted to plug real quickly, next Tuesday at noon, we are hosting a webinar on how to conduct a successful community health needs assessment. We are partnering with Eide Bailly, and so please join us. We will be recording that one as well, but we are trying to make it as user-friendly and applicable to all hospitals. So please join us next week. I will be sending out email reminders with the registration link. Thank you all.